Hi, I'm Sherri Castor. I am here today with Methodist Physicians Clinic, and I am going to show you some lower extremity exercises. Knee bends. Please do these at the kitchen counter. You want to have your feet shoulder width apart, tummy tucked, and then you will slowly bend down. You want to stick your butt out for proper technique because we want the knees to be behind the toes. As far as how low that you'll squat, if you're a beginner, please do little ones. If you need more challenge, then you could go lower, never going any lower than the height of the knee. Repeat that 10 times and do 2 sets. Marching. Please hold on to the kitchen counter, feet shoulder width apart, and we will lift a leg and march very slowly. As far as how high, if you are a beginner, you can do little marches. If you need more challenge, then you can increase the height. And if you're advanced, you can go very high. Repeating 6 to 10 times and 2 sets. Hamstring curls. Stand at the kitchen counter, feet shoulder width apart. Shift your weight over. Lift the opposite knee, bending. So for beginners, you would do it without weight. If you need more challenge, you can add an ankle weight, and then you would repeat. Repeat 6 to 10 times, and then repeat on the other side. Hip abduction. Holding on to the kitchen counter, we'll be lifting our leg out to the side. So I'll turn now to show you this angle. When you're lifting your leg, lift however high it feels comfortable to do so, and repeat 6 to 10 times on that side, and then repeat on the other side. Hip extension. Holding on to the kitchen counter, tightening your stomach, we're going to gently lift the leg back. I'm demonstrating this exercise with an ankle weight for those of you that need more challenge. If you are a beginner, you can do this exercise without weight. We don't have a lot of motion left in our hip, so we won't be going back very far. It will just be a small distance. Repeat 6 to 10 times, making sure that you're not arching your back. Quadriceps, that's the muscle on the front of your thigh. Sit in a comfortable chair and extend the leg upward. Repeat 6 to 10 times. If you need extra challenge, go ahead and add resistance by adding an ankle weight onto the bottom of your ankle. I'll turn now so you can see from this angle. Hamstring curls. This should look familiar. We also did this exercise standing up. For those of you that might have some balance challenges, you can also do this when lying on your stomach. We're just going to curl the knee backwards and repeat 6 to 10 times. For those of you that need extra challenge, go ahead and add an ankle weight. Hip abduction. We also did this one standing, but again, this one can be done laying down if you have either balance challenges or if you just want a little more resistance, because in this position we're going against gravity. So we're going to be lifting the leg up. Proper form is hips, knees, and ankles should line up in a straight line and lifting up. If you have trouble balancing on this opposite hip, you can bend the bottom leg to give you a little bit better balance, and it would look like this. Again, we'll complete 6 to 10 times, adding ankle weight if you need more resistance for increased challenge. The next one is hip adduction. That is working the inner thigh muscles. So we're going to be lifting the leg up. Again, there's not a lot of motion left in the hips, so this one is not going to be raised as high as some of our other exercises. This can be completed with the leg behind the lifting leg, or you can put this one in front and lift up. Either way is correct. On the exercises done on your side, you'll notice that I've been completing them with my head on my hand, resting on my elbow. If you don't have neck issues, this is fine. If you do, though, a better option would be to have pillows so that your neck is in a more neutral position, something that would be more comfortable. The next exercise is called bridging. This is important to keep the legs and gluteal muscles strong in order to be able to walk upstairs. We're just going to tighten our stomach and we're going to lift our butt off the table or bed and come back down. Repeat 6 to 10 times. If this exercise is too hard for you, you might choose to just come off the bed just a little tiny bit like that. Gradually working up to a higher lift. Straight leg raises. Start with one leg bent, foot flat, the other leg straight. Tighten your stomach to protect your back and slowly lift this leg up. You can make this exercise more difficult by how high that you lift or by adding ankle weights. Repeat 6 to 10 times, repeating on the other side. For those of you that would like to add a little extra resistance to your exercises and who don't have ankle weights at home, you can make them. Take a Ziploc bag and count out pennies. Incidentally, 181 pennies equals a pound. After you put your pennies in your Ziploc bag, stick that little bag in a plastic grocery sack and then take the plastic grocery sack and tie it around your ankle. The nice thing about a homemade weight is when it gets too easy, you can just add more pennies. In conclusion, if you have any questions or trouble with your exercises, please consult one of our many physical therapists at Methodist Physicians Clinic.